Okay, thank you, Mike. So, if you smoke menthols, your days of buying them could be numbered now that the FDA has decided to eliminate both menthol cigarettes and also flavored cigars.
Matthew Myers is the president of the Campaign for Tobacco-Free Kids, and he's here to talk more about the significance of this decision. Thank you for coming on. You know, this is a fight that you have had for some time, going up against big tobacco. Did you ever think that this change with the FDA might never happen?
If FDA follows through on its proposal, it will be one of the most monumental changes in reducing health disparities and protecting our nation's kids that any federal agency has taken. So yes, today is a very important day. What happens next is even more important. Does the FDA follow through? The science is clear. Menthol cigarettes lead kids to start smoking and make it harder for adults to quit, and are a major cause of the reason that African Americans have higher rates of lung cancer and heart disease.
Yeah, to your point, the CDC says that 7 in 10 young black people who smoke do in fact use menthol cigarettes. I would imagine that cessation programs are going to be at a premium should this go through. Are you concerned that there won't be enough help out there for these youngsters who are already hooked on menthol?
Well, we believe that there will be enough resources out there, but we're encouraging both the federal government, state governments, and local governments to ensure that everyone who smokes has the opportunity to participate in a tobacco cessation program. We do know how to help smokers quit. This is a once-in-a-lifetime opportunity to protect our kids, and particularly our kids in low-income neighborhoods, African-American neighborhoods, and those that the tobacco industry has targeted. One thing people don't realize, there's nothing inevitable about African Americans or others smoking menthol. They do so because the tobacco industry has targeted them as a profit center without regard to the consequences.
You know, we are talking about lives at stake here, but there's also the issue of the costs here on the healthcare industry and on taxpayers who oftentimes end up footing the bill.
That's exactly right. You know, premature deaths from lung cancer and heart disease cost our nation billions of dollars. They also cost families because half of all long-term smokers die during their most productive work years. That's money that the families need to continue to remain in middle class or to continue to grow. So this is a social justice issue. It's an economic issue. It's a public health issue. The only people gaining by the current situation are the big tobacco companies.
Well, the public, my understanding is, still has an opportunity to speak on this issue this summer. This is anecdotal, but here at Good Day, we've spoken to some people here in Chicago, and they're not too thrilled about losing the opportunity to purchase menthol cigarettes. Do consumers actually have any weight in this argument?
Well, it's important. The FDA is going to seek comments. What they're going to seek comments about is what are the public health consequences of their action? It's not a voting issue. It's not like a ballot. But what's really important to understand here is that when you see somebody dying of lung cancer from smoking a menthol cigarettes, it's almost always the last chapter of a book that began with a child. That's what we're protecting. If we can prevent kids from starting, we can reduce lung cancer rates. There's no free choice here when you're addicted as a kid and the tobacco industry continues to market to you going forward. It's the reason why virtually every major African American organization is supporting this initiative. They realize it's time to stop the tobacco industry targeting of their community.
Matthew Myers, president of the Campaign for Tobacco-Free Kids, joining us this morning here on Good Day Chicago. Thanks for your time.
Thanks very much for having me.